We're back now with a major new study in cancer research. The popular drugs used for weight loss appear to be associated with a reduced risk for some cancers. Our medical correspondent, Dr. Darian Sutton, is here now with the details on the study. You got to break this down for us.
Good morning. Yeah, this is a large study done by JAMA, the Journal of American Medical Association. So what they did was they followed more than 1.5 million people over 15 years, all of whom living with diabetes and obesity. And they compared those who used these, what we call GLP-1 medications. Now, Robin, this is the class of medications that the active ingredient to Ozempic, Wegovy, belong to. And they compared them to those who used it and those who didn't. And at the end of the 15 years, they found that those who used these medications had a significantly reduced risk of cancer. We're talking about 10 out of the 13 cancers associated with obesity.
So which cancers showed the most reduction in risk? And why do you think that the risk was not reduced in all cancers?
That's a great question, Michael. So when you look at the numbers, the most commonly, or the highest rate of reduction in terms of risk in cancer included things like gallbladder cancer, pancreatic cancer, liver cancer, all above 50%, even ovarian cancer. Now, as to why these cancers are different, I think that applies to more of the complicated question of the association between obesity and cancer, and that's still understood and not completely parsed out.
Yeah, you also have the coincidence causation.
Exactly.
Issue. Is the drug getting at the cancer, or is it about the weight loss?
That's an exact point. You know, we're looking at a study that shows an association, not necessarily a cause and effect. And you have to take a step back and understand what is that connection. And the main theories include things like hormone disruption and obesity, factors like growth factor and insulin increase the risk of cancer. Also, immune system dysregulation. Our immune system helps us to fight cancer cells. And then also there's that factor of chronic inflammation. The question is, how do these medications fit into that puzzle and reduce these risks?
It seems like we're talking about these drugs every single week. There's another breakthrough here and there. Many consider them wonder drugs, but there are drawbacks to taking them.
Yeah, you know, I don't like the term wonder because in medicine we always have to make sure that we keep a critical eye on the risks. And so we see these beneficial things. Not just in weight loss, not just in things like reducing the risk of cancer, but also reduced risk of kidney disease. Even in some studies showing reduced risk of anxiety and as well as problems with addiction. So when you look at these studies, we have to question what are those benefits, but then also we see certain risks, but we don't see them in every single patient. So it just reminds us that when we're trying to make a decision whether or not to use these, you have to have a formal expression, or excuse me, understanding of what these risks are, because just like weight loss, it can be different from person to person.
Sure.
All right, Doc. Thank you so much for that. You're not going anywhere. Dr. Sutton's
I'll be
going
back.
to be back. Yeah. We're going to talk about the recall on mushroom